Hello, I'm Dr. Likhita.
Hello, I'm Dr. Maitry.
Today we are going to answer some of the frequent questions asked by young homeopaths.
Yes, and let's keep it interactive, right, Dr. Likhita?
Yes, one of the most common questions is regarding acutes. Is it okay to repeat frequently and use higher potencies?
Earlier, I was struggling with the same question, but it is important to choose the frequency and potency on the phase of disease. Sometimes we choose medicine correct, but potency is low and it doesn't help to the patient. So we thought homeopathy doesn't work, but homeopathy works when you should know how to use it. You can repeat every 2 hourly, every 4 hourly, or 4 times a day, 3 times a day. But same time you can choose a high potency according to requirement. We generally start from medium potencies.
The idea of high potency differs from time to time and system to system. In olden times, during Hungarian time and Kent's time, 30 was considered the highest potency, whereas in few systems 200 is considered the highest potency, and in few others 1 m is considered the highest potency.
Oh, this is the interesting question. Is it necessary to counsel patient after the case taking?
Of course, it is important to counsel a patient after case taking. As a homeopath, many a times we explore the areas of patient which are their emotional stresses and stresses in their lives in general. When we ask such questions, many a times patients will become emotional during the case taking. At that time, it is like we are a surgeon who opened an incision and finished the surgery without closing the incision. As we open the patient's emotional traumas by case taking, it is necessary that we end it by explaining it to them where about their situation and where they can improve themselves. In a way, we are also making them aware of themselves by doing counseling.
Counseling is like applying balm to the pain soul. Once you counsel a patient, you are also making them see their situation from a new light or a different light, and also making them aware where a change can be brought in their lives.
The next question is regarding case taking. Is it advisable to ask leading questions to the patient?
I would like to say don't ask that type of question which end up with yes and no. Don't ask that type of question from which patient have to choose from options, but surely you can guide patient in their histories which is quite long, and to avoid getting lost in the story you can guide them in their history.
A question becomes a leading question when you are already thinking of a remedy, when you are asking questions regarding the remedy, then it is to confirm the remedy, which is not advisable because you are already looking at the patient with a prejudiced mind.
There is next question is many times we physicians are scared of aggravation, scared of suppression, how to overcome it.
As homeopaths, we are often doubtful of our prescriptions and we lack the confidence in our prescriptions. When the remedy is selected on the basis of keynotes and when we read about the remedy in the Maitry Medica, the accuracy of our prescription increases and so does the confidence in our prescriptions. If there is an aggravation, you can always advise a patient to have a cup of coffee or apply balm to the pulse points.
Right. And rightly prescribed medicine doesn't suppress. Only way to get over fear is aggravation of suppression is increase your confidence in your prescription and same time read from the different book, learn from your practice. It will comes with practice, not just in one day.
Another interesting question is it okay to prescribe rare remedies where we can't prescribe regular medicine?
Symptoms match there. There is no such things as a rare remedy or a regular remedy. Any remedy covers the whole of a person or a person as a whole can be prescribed. Doesn't matter it is a rare remedy or a regular remedy. Another question regarding the case taking. What are the importance factor one should explore in a patient's life apart from their history?
Apart from life history, there are many factors like behavior pattern, situation at workplace, situation at home, relationship with family members, relationship with friends. These are all indirect factors which lead us to the core of the patient's personality. Other areas to explore are the pace of his work, ambitions in life, fears, sleep, and dreams.
So we are done with so many questions, right, Likhita?
Yeah.
Let's talk about the new system or a new approach.
It is called the Joshis map system. Map meaning mineral, animal, and plant.
There is the foundation of this system is interrelation between all the kingdoms, how the same person require the plant kingdom medicine, mineral remedy or animal remedy in course of treatment.
This is just a basic view of the Joshis map system. There is many more interesting things about the system which will be explored in further videos. Stay tuned with us to know more about the system and how it can be applied in everyday practice.